Hey everybody, what's up Facebook? Dr. Renato here. I've got some baby mama drama for you to share today. Really what we're going to do is answer this question: should pregnant moms get chiropractic care? Is chiropractic care helpful during pregnancy? Well, of course, right? So let me break it down to you and explain to you. I mean, if you just think about it for a moment, the entire process is like structural, is physiological in nature. You have so many changes that are happening for mom and the baby. So I would say chiropractic is great for both the mother and the unborn child. If you're thinking, well, how can the unborn child be helped by chiropractic in the womb? Well, think of it this way: the entire miracle is so detailed. Think of all the cells and the neurons that have to develop and connect. So when we adjust the mother, not only is her nervous system functioning properly, but also the nervous system of that unborn child yet. So, but let's talk about the mom. So there's big body changes that are happening for mom, and that's really what I want to talk about today. And there's a lot of symptoms that come on early on in the pregnancy, and a lot of folks think that those symptoms are normal, but they're just common, right? So just because somebody else has something doesn't mean that doesn't make it normal. That's my point. So like headaches, migraines, feeling nauseated, tired, fatigued during the pregnancy, those things are very, very common, but not necessarily normal. So, but let's talk about the structural changes. So I want to talk about misalignments of the spine, or the subluxations. You guys have heard me use that big word, subluxation. So think of it this way: as the baby is growing in size, so does the mother's abdomen, the uterus, the chest, everything has to grow and start to push forward. So if you're looking at the spine from the side in the low back, there should be a nice curve. And guess what's happening during a pregnancy? It's going this way, right? So these two big bones here, the hip bones, they're tilting forward. The spine is going into more of an extension. So that's gonna contribute to misalignments or subluxations in the spine. And the big one here is this idea of anterior pelvic tilt. So these two big hip bones, they go way forward and the spine pushes back, and that's gonna put quite a bit of stretch. I mean, everything is already stretched and loose anyways because of the hormone relaxant, but think of the stretch that's putting on the structures and the muscles and ligaments, and that can result in like pelvic, so hip subluxations, low back subluxations, as that low back curve is increasing. And then think of it this way: so like as the uterus is growing, there's the baby is growing, so that's going to push on the diaphragm, and that can contribute to things like acid reflux or heartburn. And then lots of moms will end up with like tension in the neck. That can lead to headaches. You have weight gain. Hormones are all over the place. So there's a number of things that are contributing to the possibility of the misalignment. And then I got another friend here, this little baby doll, and I had to borrow this from a little friend of mine. Her name is Ellie. So thank you so much, Ellie, for borrowing me your baby doll friend. I have 3 boys at home, so there's no dolls at home. So I want to explain to you that this is pretty close to what an unborn child would look like. Just picture it structurally here, as this baby has to come out through the birth canal, and we all know that the child has to make a couple different twists and turns through the process. So we want to make sure that the hips, the low back, everything is in alignment, so that birthing process, the labor and delivery are going smooth, so that they don't have to resort to things like suction or forceps, or oftentimes you end up in a C-section, right? Sometimes those things are necessary, and we're not talking about that. Just talking about natural delivery and birth. So this baby has to have a good spacing to come out naturally. So yes, chiropractic is super, super important during pregnancy, even if you're not symptomatic, right? We've already talked about how symptoms don't really tell you how healthy you are. So it is good to keep an alignment. Research does show that better labor and delivery through chiropractic care. And then also, as a child is born, of course, we can check the baby and make sure that the child is functioning and developing properly as well. So I hope you guys had fun watching that. I hope you liked my analogy with the little baby doll on the hips. Yes, chiropractic can help. If you have any questions or comments, if you're wondering what that game is in the back, here, you can comment about that too. Just hit a like button or something and share this video with others too. So thank you guys so much for watching, and enjoy this beautiful weather, and I'll hit you guys up next week. Thank you so much.